to like a pool party, and my mom was noticing that I was walking a little bit more to the left, and she was like, just stand up straight, and I was like, I'm standing up straight, there's nothing wrong with it. So she took me to a doctor's, and the doctors said, and I quote, "Is anything hurting?" My mom said no. Then there's nothing to worry about.
Adolescent patients with severe scoliosis most often do not feel any type of significant pain. If they feel any type of pain, it's a dull ache at the site of curve that's normally resolved by rest, nothing significant, nothing that stops them from doing anything. What we do know is as these curves progress in the adult stage, the body's adapting to them because the patient is growing around the curve. These curves can become relatively severe with hardly any type of functional pain problems. The biggest curve I've ever seen in a growing child has been 155 degrees, and that child had no pain, was functional. It came in and out of the office and did things. Pain is not an indication for treatment. However, pain with a scoliosis patient could be an indication that something else is going on in addition to just a scoliosis.
One of my legs started hurting a bunch. Eventually we went to a doctor, and he immediately said, no, you need surgery, and like, when do you want to plan? Like, he was really forward on getting the surgery.
They kind of scare you in some way to say it. My mom said, "Are you crazy? She's only 13. You're gonna put something inside her body that is not from the body." My mom was the one that shut down the whole idea of surgery, pretty much.
So we went home, we looked for more options, and this is when we found a doctor in California.
The doctor in California was really good. He did pretty much the treatment, explained everything, we follow all the steps. But to go back to California to keep it with the treatment was too expensive. After seeing all the results that he had with other ones, questions, and the equipments and how everything is organized, pretty much that's why I came to Dr. Tony.
So the first 2 weeks I was here, I remember coming into this place and I was like, this is so much. Like when I first walked in, like I walked up from the stairs, I could already feel the ground shaking from all the machines, and I was just shook. The two girls upstairs, they really helped me to get through all the treatments, and they were just so kind that it made me want to keep going.
When it comes to the scoliosis rehabilitation and treatment, we're using a lot of physical treatments that are conservative in nature, that are helping push the spine and make the spine more flexible and mobile so it can respond better to our corrective bracing and our corrective exercises. So a lot of times we're using some traction equipment and some machines that are helping us do this. Initially, when you see this piece of equipment, it can seem somewhat frightening. Like you're seeing this table with straps and you don't know what it's going to do. But once patients are in it, especially kids, they're normally like on their phones, watching screens, listening to music, those kinds of things, because it's not an unbearable amount of pressure. Some of my staff actually has scoliosis, and they've been through these equipments and they've gone through it, and they can actually tell patients, hey, it's not that big of a deal. And of course, we're weaning them in slowly over time. So our staff is very knowledgeable to kind of start off with a very light amount of pressure and then increase it as the patient is tolerating it well, because we want them to be able to tolerate it so they can get the results that they want.
It was so amazing to see like the process of going through the rotations and seeing how much my spine can go better. The first 2 weeks, I came in with 67, I believe, 57 degrees. And during the end of the 2 weeks, without any support, without the brace, I would have been at 58, I believe. And then with the brace, which is to hold the curve from getting worse, I believe I'm at 48 degrees. The staff is so amazing, they're so supportive. Dr. Tony is just he's like the type of person that he needs to be serious when he is, but he can be so funny at times that it just makes you have a smile on your face.
He make you feel that all the force and all the results of what you're going through is because of you, not him. He's giving you the tools, but you are doing the work. And that gives you more courage, like, I'm making this happen, you know?
All the results are on the patient's shoulders. Now, of course, getting a good program is my job, but doing the work is 100% the patient's job. So therefore, I always say the results are 100% patient-oriented or patient-driven. Without a patient that's active and that's involved in the care and doing it, we're never going to get a good result. So when we get great results, the person that we're thanking for those good results is not going to be me, it's not going to be my staff, it's going to be actually the person that's actually performing that, and that's normally the child or the patient themselves. They're the heroes in this thing because they're the ones that are working to get the results that is actually needed to get better during the scoliosis reduction phase.
And I'm pretty sure with Dr. Tony, we've been seeing the results, so we're gonna keep going, and really it's been amazing. It's been an amazing journey.